Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
A 32-year-old female is diagnosed with bipolar I disorder. While discussing with her information about her diagnosis, medications, and anticipated course of illness, the patient asks if she will need to be on medication forever or if this is something that will get better as she ages. The psychiatric mental health nurse practitioner advises the patient that A, with good medication adherence, exacerbations will fade as she ages. B, depressive episodes tend to be less severe, but manic episodes tend to worsen. C, depressive episodes tend to worsen, but manic episodes tend to improve. Or D, the general trajectory of bipolar disorder typically worsens with age. This is an interesting question, and a question that actually is very common. Many times when you put patients on medications for any disorder, whether it's a mental health disorder or even in any aspect of medicine, you get the question with patients being medicated for hypertension or diabetes or whatever. But in mental health, it's very common because most people with mental health diagnoses that require medication, they don't want to take them, and they surely don't want to take them forever. So one of the first things they look forward to is, okay, how long do I have to take it before I can stop? So in any event, it's a good question in clinical practice to be able to address, and it's a question that it would not surprise me if you have to address it on your boards. And in this circumstance, with respect to bipolar I disorder, unfortunately, D is the correct answer. Bipolar disorder tends to get worse over the lifespan. It tends to get worse as patients age. Unlike major depressive disorder, which actually tends to peak, remember the peak onset of major depressive disorder is in young adulthood. And then symptoms actually tend to, for any particular patient, they tend to abate through middle age and then may resume in older age. But with bipolar disorder, bipolar just tends to get worse over the lifespan. Over the age of 60, patients with bipolar disorder tend to have shorter euthymic episodes between poles. They're more likely to experience manic episodes and may spend more time depressed. Further, medications in patients with bipolar disorder over the age of 60 tend to be less effective. You may see a patient who has been well medicated, or well managed, I should say, on medication for years and years and years. And then as they approach that older adult place in the lifespan, those same medications just don't offer the same level of control anymore. And then morphometric changes, brain shape and, brain anatomy changes that are just normal changes associated with aging often result in circumstances that can lead to bipolar exacerbations. Poor sleep is a classic one. Poor sleep is in its own right something that renders patients more vulnerable to cycling, particularly those that are characterized by manic episodes. So yes, in this circumstance, the best answer to the question is D. The general trajectory of bipolar disorder typically worsens with age. And so, forewarned is forearmed. The patient expects something, it just becomes more tolerable. The old saying about the devil you know is better than the devil you don't. So, when a 32-year-old female with bipolar disorder asks you if this will get better, if she takes her meds every day and she does everything she's supposed to, will there come a time when she doesn't have to take medication? Will it get better? The answer is no. The honest answer is no. And in fact, as she gets older, we have to be more and more cautious because when medications that have worked for a very long time may suddenly just not seem to do the trick. They may have shorter times between cycling, and the cycles themselves may be more extreme, which warrants a change in medication approach.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.